Hello, and thank you for tuning in. My name is Sarah Thompson, and today I'm going to give you a brief overview of music therapy in brain injury rehab in the work comp system. The title of this presentation is Music Therapy and Work Comp, Focus on Brain Injury Rehab. It's always nice to know a little bit about your speaker, so I wanted to tell you just a few key points about me. I've been a board-certified music therapist for over 17 years. I also serve on our National Reimbursement Committee for the American Music Therapy Association. I'm a national speaker, a researcher, and a book contributor as well. And I'm currently the CEO of Rehabilitative Rhythms, a 501c3 nonprofit in the Denver, Colorado area. This talk is really going to be focused on the medical treatment guidelines for traumatic brain injury, specifically in the state of Colorado. You may know that work comp is a little bit different in each state. And here in Colorado, we have the rules laid out on the website for the Division of Workers' Compensation. Anyone is welcome to look those up. Today, I'm going to just briefly touch on Rule 17, Exhibit 2B, which is moderate and severe traumatic brain injury. And I'm also going to be speaking about music and music therapy and how it really fits into the work comp system. Now, in these medical treatment guidelines, music therapy is listed under cognitive treatment, cognitive communication treatment, mobility, muscle tone and joint restriction management, and then also in the three main settings that we think of with brain injury rehab, which is the acute setting, the outpatient or post-acute rehab setting, and home and community-based rehab as well. So really what this is addressing is that music therapy can be used to address cognitive goals, speech and language or communication goals, and then sensory motor goals as well. So many people have never heard of music therapy being used in a work comp system. That's why I put this talk together. So I wanted to just lay out a few ideas, just a brief talk, a brief explanation of how music can be used in the work comp system. First of all, it's helpful to understand how music neuroscientists and music therapists think about music. For a lot of non-musicians, they think of music as just one thing. Well, you're using music to do X, Y, and Z, accomplish a specific goal. But really, music is made up of so many different things. So music is made up of rhythm, melody, familiarity, preference, lyrics, meter, and harmony. And there's many, many more elements as well. Let's take rhythm, for example. The rhythm of the music is the part of the music that makes you want to tap your toes. The harmony of the music are the chords that are being played maybe by the keyboard player, the guitar player, if you're thinking of a band. The meter is really if it feels like a waltz or a march. That's a really simplified explanation of meter. The melody is what's going to make you hum. It's if you're walking around the house humming a song, you're probably humming the melody to the song. Familiarity is how well you know a song. So do you know every single word of a song without even having to think about it? Or is it a song where you really only know a couple parts to it? Preference is how much you actually like it. So there may be songs that we know really well, but we don't particularly like. Sometimes parents will end up hearing a lot of songs that their kids listen to, but they may not particularly like them. And then, of course, the lyrics are the words that you sing. Some music has lyrics, some does not. But each of these elements is processed a little differently in our brain. And music neuroscientists research individual elements of music, and music therapists use individual elements of music. And that's why we typically do things live, is because we can manipulate and change and hone in on specific elements of music and use that to achieve a therapeutic outcome. So there is a lot of research, just a lot of research about all the different elements of music. And really, this is best practice, is to research elements of music and specific techniques in music therapy. So this is a screenshot from a Google Scholar search that I did. I am recording this at the very end of the year 2020, and I limited my search to any results that have occurred since, any studies that have been published rather, since 2019. And I specifically was looking for musical rhythm perception. So I was honing in on, if we go back here, just one little slice of that pie. I was really honing in on rhythm. And just since 2019, we got over 16,000 results. That's 16,000 results of studies that have been done just on rhythm. Then if we look at harmony, we see a similar thing. Same time frame since 2019. Musical harmony perception, we get over 13,000 results, right? So we've got a lot of research just with two little elements from our pie. We've got well over 20,000 research articles just in the last year, just with two of these little elements. So there is a ton of research, and that's actually one of the biggest misconceptions about music therapy that I often hear, is that there's no research or there's not enough evidence to show that music therapy works, and that's actually not true. Some of these studies that I was highlighting are basic science studies or music perception studies, but then these are tested in more and more clinical situations and addressing more and more functional outcomes. So this is just kind of the base layer of research. But it's still extremely helpful because when we see changes in individuals as a result of music therapy, we know it's not only from the technique that we're doing, but we can actually drill down into the neuroscience of what we believe is happening based on the wealth of studies that are out there. So using these individual elements of music therapists typically use live music. We are musicians, so we typically use live music and do things in a really specific manner for that particular person that we're working with. And these are the goal areas that we typically work on. We typically work on initiation of all kinds. So you'll see with brain injury that folks often have trouble with initiation. They have slower processing speed, and trouble with initiation, and there's some techniques and things we can do to address that. Expressive speech, awareness, attention, memory, executive functioning. So a lot of those cognitive skills. Mood and motivation. I've certainly been in situations where someone was experiencing a lot of mood disruption after their brain injury and just didn't want to get out of bed. But if we're able to include some really motivating aspects of music that they like into what we're doing, it can really help them get going. For example, if I co-treat with a physical therapist and we're able to use some of their favorite songs for some of the exercises that we're doing, and we're using the live music to facilitate what's happening, we see just exponentially better response than we would have if we just tried to force them to get out of bed. So certainly lots of good results with that. Coping and, emotional coping can be really important for folks at certain stages of the recovery process. And then general coordination. Rhythm can be really helpful for apraxia and general coordination. So that could be limb apraxia or oral motor apraxia. Rhythm can be really helpful for those things. And then also endurance. We see that people will often continue doing what they're doing to get to the end of a song, right? Music structures time for us really nicely. And so we can be really strategic in how we combine these different elements and maybe use a highly preferred song, and we're facilitating whatever the movement is or whatever the task is, but then we're also facilitating that endurance as well. Hemiparesis, so when there's a weakness or paralysis on one side, we can see that even out with some musical cueing. And then, of course, working on gait. And you may already know, but there's well over 80 studies on rhythm and gait out there. So it's a highly researched area of rehab. Another big misconception is that listening to recorded music is music therapy, that there really is no difference. So I wanted to make a comparison here. So on the left side of the screen, we have a woman who is walking with a turquoise jacket on. She's going for a walk. And I think everyone would agree that that's a really healthy thing to do, to go for a walk outside. She's in the sunshine. That's a healthy choice. And then here we have a little boy who's listening to music, and he seems to be enjoying it. And again, seems like a healthy thing to do, something that would make you feel good. And these are both general uses, right? So on the left, the woman walking in turquoise is generally using movement in a general way. So she's going for a walk. And it's good for her, but it's a general use of movement. This little boy here's listening to music, and that's a general use of movement. And anyone can do these things, and most people do these things, both of these things. So that's a really common thing. Everyone is free to do that. But if we're looking to achieve certain outcomes, specific outcomes using these mediums, then we want to certainly consult a professional. This is really where you get into skilled intervention. So here we see a physical therapist doing a session with a woman who's doing specific movements to achieve specific outcomes. And then this other picture is a little boy who's engaging in specific things with music to achieve specific outcomes. That instrument he is playing is called a cue chord. And I believe in this picture, he is working on some fine motor skills. And again, these are skilled interventions where you're using a particular medium to achieve a specific set of outcomes. So we know what goal areas we can address, but then how does that translate to getting back to work? In brain injury rehabilitation, again, I mentioned that we can certainly use music to address gait, and I wanted to provide an example here for you. So this was a situation where this individual was a TBI survivor. He was still in PTA, post-traumatic amnesia, very confused and just not very compliant. Didn't want to participate, didn't want to leave his room, didn't want to walk for long periods of time. He had shuffling steps and a lack of endurance. So he was getting physical therapy, and in the first 3 sessions, his physical therapist was measuring how far he was walking. And you can see he was a little over 500, maybe around at the peak and maybe around 700. And then at that green arrow is where I was asked to join. And so it became a co-treatment session, and we were able to use some musical elements to facilitate his walking. And then we saw a dramatic increase. So we got like 3 times the distance walked in feet when we were using a music therapy, physical therapy co-treatment, and these specific elements of music. And then you can see on the graph here that the distance walked in feet just continually went up each session as well. So in terms of thinking of how much you are getting a return on the investment of paying for that 1 hour. So you're getting 3 times the results immediately, right? These are literally consecutive sessions that happened, and we got an immediate response when we included some music therapy techniques. Another example is using melodic intonation therapy. There are some other neurologic music therapy techniques as well that we can use, but melodic intonation therapy is one of those that people are often familiar with. It's typically used for someone who has non-fluent aphasia, or some people would call it expressive aphasia or Broca's aphasia. So you may see someone struggle to get words out. They may get stuck on certain words and try and use that same word over and over to communicate a wide range of ideas. And what's interesting is, thinking back to those neuroscience articles, we know that singing and speaking are slightly different in our brain. And so what we often see with folks who have non-fluent aphasia is they're actually able to sing quite fluently. And so we can use that then, use some specific music therapy techniques and use their ability that is intact, which is their ability to sing, to help retrain their ability to speak using neuroplasticity. So if we had, say, someone who wanted to return to working in a coffee shop, if we want them to be able to ask people, what would you like today? Or something like that, we can use some techniques to use their ability to sing to teach them how to speak, help them regain their ability to speak through neuroplasticity. And then after we fade out the music, they are in fact able to do that. So again, we're not using music therapy techniques to return people to tasks that they've never done, right? We're not teaching them new skills necessarily most of the time. So we're not going to take someone who worked in a coffee shop and was never a musician and teach them how to play guitar if that was never something that was part of what they did prior to their brain injury. We want to return them as much as possible to the skills and abilities that they had before. And of course, return them back to work as much as possible. So typically our outcomes are not musical outcomes. We're typically looking for non-musical outcomes. Again, we're using that music to stimulate that neuroplasticity and looking for what happens after the music. Are they still able, after we've gone through our therapeutic techniques, are they still able to say the phrase that we're looking at? The phrase that we want them to be able to say. Now, if they're musicians, obviously we would like them to get back to playing music. But for the most part, we're using music as a tool to facilitate our outcomes. And we typically start with assessment and goal setting, just like every other therapy, physical therapy, occupational speech therapy. And then we engage in treatment and track progress, and then discharge folks once they've reach their maximum level of outcome, and we've been able to do as much as we can. And hopefully at that point, they're able to return to work. Again, it depends on the severity of the injury. And as we know, the rehab course is different for everyone. Now, while you may be new to learning about music therapy, I do think it's something that you're going to see quite a bit in the years to come, because there's more and more and more research happening and more awareness of the research that has already happened. So just recently, the National Institutes of Health awarded $20 million to do some additional research on music therapy and neuroscience. They have this Sound Health Initiative as well to explore the benefits of music therapy. And I know I've seen more funding opportunities from the NIH even since this announcement. So it's just happening more and more, and people are really understanding that there is a true neuroscience to these music therapy interventions and techniques. If you have watched this presentation and you're thinking, I think we might want to have a further conversation about music therapy and work comp for my situation, feel free to reach out to us. Our website is possiblewithmusic.org. We have a lot of resources on there, and then you can look at the contact page as well. Typically, to get started, we need to speak with the case manager and speak with the individual or a family member as well. We do typically need a doctor's order to get started and some key information about billing workers' comp as well. So I hope that this has been a really helpful overview for you about music therapy and work comp. There's much more I could say about it, but this is meant as just a brief introduction to music therapy and work comp, and to just really give you an overview of how it can work. So thanks for watching.